The biggest public or most disastrous public health failure in 100 years, and we're right in the middle of it. Hi, I'm Mazza. I'm the corporate correspondent for the website and Gonzo Journalism Report. We do the work. Let's start with the situation that we're in. The biggest public or most disastrous public health failure in 100 years, and we're right in the middle of it. Now, think, since the Spanish flu epidemic in 1918, the advances in medical science over that time. So you have to ask yourself, why are we in this position? Why are we in a position where we don't have enough ICU beds? We don't have enough PPE. We don't have enough staff. We don't have enough of anything to actually handle this epidemic. And here's what I'm hearing. I'm hearing from Trump. I'm hearing from people online. I'm hearing from reporters. And what I'm seeing implied by actual hospital administrators is nobody could have anticipated this kind of a virus. No one. So we're dealing with something that's totally new. We had stumbles for 3 months, but now here we are. We did anticipate, or people who are experts did anticipate this kind of an outbreak. And one of the best reports I saw was 2005. That was the Department of Health and Human Services, 400-page report called, let me look, Pandemic Influenza Plan. This is what this report said. Remember, 15 years ago. Future outbreaks could be much more dangerous because they could be spread by asymptomatic people, that is, people with no symptoms. That was 15 years ago. They said exactly what's happening now. The demand for inpatient and intensive care beds and assisted ventilation services could increase by 25%. Mechanical ventilation would be needed by as much as 65,000 instances. A more severe epidemic, like the flu of 1918-1919, could result in ventilator shortages and in rationing of ventilators. Remember, 15 years ago. It predicted how many ventilators might be needed to stave that off. This was 2005. 742,500 ventilators. That was one report from 2005 from a federal agency. There were others. May 2003, General Accountability Office, U.S. General Accounting Office, again 2003. 2005, Congressional Research Services. 2006, Congressional Budget Office. These are all reports about the same thing, dealing with a pandemic influenza. 2007, Interior Department. 2009, Occupational Safety and Health Administration. 2009, President Obama's Council of Advisors on Science and Technology. They all say the same thing. And here we are, even after these warnings. So what are we seeing? We're seeing a healthcare system that's profit-based, completely and totally profit-based, that has nothing to do with public health. Absolutely nothing. So then we get to the position of saying, who is accountable for this situation? Clearly, there were many warnings from experts over the years. Who's accountable? Well, you can blame Trump. He's a good one. He's a reality TV star. That's one. Let's go down to the administrators of the local hospitals that we're now dealing with, who clearly either never read these reports or are making so much money that they just didn't give a damn. They did nothing. They prepared for nothing. They structured their hospitals like a goddamn Toyota factory, just-in-time inventory. And so they don't have the equipment, they don't have the staff, they don't have the beds, they don't have the ICUs, they don't have the ventilators, even though all this was given to them, all this was predicted, all this could have been planned for. And yet they stayed in their role. They collected their $1 million. And by the way, another thing anybody should do is go look at your local hospital systems, look at their websites and see their leadership. It's all on there. They've got professional headshots and all kinds of good stuff with their resumes. You'll see, like Minneapolis, one of them is run by a former attorney. One is run by a guy who's a PhD in statistics. So find this out. See who's running these systems, and you'll find they're all MBAs. And what do? How do they get into this role? Well, you work in the system in some kind of low-level job, and you go, why am I working for peanuts? I could be making some real cash. I'm going to go get an MBA. I'm going to drink that free market Kool-Aid. And then I'm going to get a real job making some serious coin. And basically, that's what all of them did. And now they're protecting their income and their massive contributions to their pension plans. So there's two things you need to do. Look that up. Go into the IRS site and look at the tax reports of these firms, and you will see a list in Part 7 of every 990 tax form that lists every single executive and highly compensated employee with their name, their role, their title, and their salaries. And you post that in your break rooms.
Could you say something more about what is taking place on the internal command centers right now, and are they afraid of litigation?
Yes, what's taking place in the internal command centers, like any company, any corporation with a problem that could result in litigation. You saw this happen with Tylenol years ago with the cyanide incident, anything, BP with the Horizon. All of a sudden the lawyers jump in, they take over, they control the message, because the biggest issue they want to face, or they anticipate facing, is lawsuits. Again, you've got staff that are not properly prepared to deal with a pandemic based on your decisions as a hospital system and executives. So the lawyers are taking over. The lawyers are controlling the message. The lawyers are circling the wagons to make sure that there's no frontline people. For the most part, there's no frontline people involved in any of these incident command teams. And that's very deliberate to keep those people out. You don't want them to see what's going on behind the scenes. If they see it, if frontline people see what goes on behind the scenes and see how it's driven by attorneys trying to avoid lawsuits, by money particularly, they'll totally lose faith in the system. I mean, a lot of them will go, what am I risking my life for this bullshit? My advice to the frontline workers is, first of all, arm yourselves with the information you need to have on your time off. If you can do it, we'll provide a lot of it. Understand how the system works, and understand that you are just cogs in that wheel. You are parts in that system. You are not valuable in and of yourself. You are valuable as a way to make profit, or as a way to keep the system going for these executives. And that's what you are, like in an assembly plant. And when you understand that, then you know how you have to protect yourself, how you have to make demands of that system, because you're in a power position now, and absolutely make demands of that system and threaten that system, because otherwise you are being thrown under the bus to protect the reputation of the chain, to protect the income of the executives.
Is the system potentially scared of its own frontline workers?
The system absolutely is scared of its own frontline workers at this point, because what happens if the frontline workers decide, I'm not even being protected, I'm walking? Then what do? I mean, they're not going to come down and treat people. They don't even have a medical background, most of them. So you have a system that's under siege, and when they're under siege, and they're also incompetent, and they're also grubbing for money, as they've all done, then you have a system that's very dangerous for frontline workers. Very dangerous.
Do you want to give any shout outs?
I want to give a shout out to all the frontline workers, to everybody standing in the grocery store, to everybody dealing at the gas station, to anybody doing anything to keep a modicum of economy running in this situation. All the small business owners that are without income at this point. I mean, this is what happens when you have a total failure of a for-profit healthcare system. You just take down the entire economy.
And what would you say to the CEOs if you could speak to them?
I would say you need to resign right now. You need to leave, and you need to apologize and resign in shame, and give back a lot of your paycheck that you've accumulated, because you have been useless, completely and totally useless. You played the game, you played the for-profit system, you did it all for your own benefit. Now it's time for you to go.
All right, folks, you heard it. I'm coming to you from my webcam because I'm too lazy to set anything else up. Anyway, get those 990s into your break room. 990s outline the income of the nonprofit executives that you're working for. If you need help finding the 990s, reach out to us. We'll give you all the assistance that we can. Go to our website, WDTW.org, and sign up for our mailing list. Check out our Frontline Forum. We just launched it. We want to hear your stories of what's going on in your workplace regarding frontline issues with COVID-19 or anything that's going on in your workplace. And lastly, drop us a little donation. As you can see, this is all taking place from our living rooms right here. It's funded and supported 100% by us, working people. We'd really appreciate it. Stay tuned. There's tons more to come.